So the next theme of questions we had several questions around what is a pessary, and I guess how does it help, what does it do. So for those who aren't aware what a pessary is, it's essentially a medical silicone device, and it is inserted within the vagina to provide support to our pelvic system. So first things to understand is that if we're looking at our pelvic cavity and you've got your bladder, your vagina, and where your uterus would be, and then you've got your rectum at the back, all of that is held up by fascia and connective tissue. So that's kind of like our level 1 support system. Now, sometimes for multiple reasons, it can be changes in hormonal cycles, changes in weight. Maybe there's been a defect which has occurred during birth, but for whatever reason, that fascial system has started to change, and we can see movement of pelvic organs sitting down a little bit lower in that pelvic cavity. So some ladies will experience symptoms of prolapse. There are certain criteria which we have to go through to be able to diagnose prolapse, and generally it's the fact that a pelvic organ has to be sitting close down to that introitus and that level of the vagina. So you might notice that heaviness, that pressure, or sometimes ladies will be able to see a little bit of a bulge. But then you've also got to be feeling those symptoms of the heaviness and pressure for us to accurately diagnose prolapse. We do routinely prescribe pessaries to a lot of our patients for different types of reasons. So it may be that based on a vaginal examination and certain measurements which we take, that there may be potentially at risk of experiencing a symptomatic prolapse at some point. And for example, if that was something where maybe your goal is to return to high impact or to do high intensity or weightlifting, powerlifting, sometimes we may prescribe for a certain type of patient in that case. But then also for our ladies who experience those symptoms I described, a pessary will be quite beneficial for a lot of patients in terms of if we were to insert it throughout the vagina and if it could provide that upward support and relieve those symptoms that a lot of ladies experience. 50% of females actually have a diagnosed prolapse, so it is quite common. Now, something else just to mention is with prolapse, it is actually really important that you do have an assessment from your women's health physio in conjunction with your GP or your gynecologist, because a pessary might not be the best option for you. In some situations, there are other forms of treatment such as surgery, which some ladies under the guidance of their medical practitioner would prefer and may be more suitable. But a lot of the time in physio, we find conservatively using something like a pessary can help a lot of our females to manage their symptoms.